Feeding and nutrition of infants discuss breastfeeding, the best way of feeding up the children born in time, perfectly satisfy children feeding needs, protects against the feeding allergy, fully aseptic, and improve child immunity beginning a few hours after delivery, feeding on demand minimum 6 months, no cow milk till 12 months to avoid iron deficiency, jaundice is recommended breastfeed once. Jaundice is not recommended, is recommended to breastfeed more. Most mothers stop breastfeeding at around 18 months. Solid nutrition introduced after first 6 months, mostly vegetables, fruits, ground food, boiled potatoes, supplementation of iron per term 1 month, 2 milligram per kilogram, or term 4 months, 1 milligram per kilogram, formula in case of intolerable breastfeeding. Human milk feeding decreases the incidence and severity of diarrhea, respiratory illness, otitis media, bacteremia, bacterial meningitis, and necrotizing enterocolitis. Infants who are breastfed may have reduced risk of asthma, obesity, type 2 diabetes, ear and respiratory infection, and sudden infant death. Syndrome SIDS. Mothers who breastfeed have a decreased risk of postpartum hemorrhage, more rapid uterine involution, no longer period of amenorrhea, and decreased postpartum depression. Adequacy of milk intake can be assessed by voiding and stooling pattern of the infant. A well-hydrated infant's boils 6 to 8 times a day. Rate of weight gain provides the most objective indicator of adequate milk intake. Total weight loss after birth should not exceed 7%, and birth weight should be regained by 10 days. The mean feeding frequency during the early weeks of postpartum is 8 to 12 times per day. In the newborn period, elevated concentration of serum bilirubin are present more often in breastfed infants than in formula-fed infants. Feeding frequency during the first 3 days of life of breastfeeding fed infants is inversely related to the serum level. Bilirubin frequent feeding stimulate meconium passage and excretion of bilirubin in the stool. Infants who have been sufficient to milk intake and poor weight gain in the first week of life may have an increase in unconjugated bilirubin. This is known as breastfeed jaundice. The use of water supplement in breastfed infants has no effect on bilirubin levels and is not recommended. Vitamin D supplementation 400 IU per day starting soon after birth. For breastfed infants, breast tenderness, engorgement, and cracked nipple are the most common problems encountered by breastfeeding mothers. If a lactating woman reports fever, chills, and malaise, mastitis, should be considered. Treatment includes frequent and complete emptying of the breast and antibiotics. Breastfeeding usually should not be stopped because mastitis commonly has no adverse effects on the infant. Maternal infection with HIV is considered a contraindication for breastfeeding. When the mother has active tuberculosis, syphilis, or varicella, restarting breastfeeding may be considered after therapy is initiated. Medical contraindications for breastfeeding include pediatric galactosemia in infants with phenylketonuria. Drugs that are absolutely contraindicated. These include radioactive compounds, anti-metabolites, victim, and certain antithyroid drugs. The vast majority of commercial formulas are cow's milk-based. By approximately 6 months, complementary treating of semi-solid pureed food is suggested. Cereals are usually introduced first, and it is recommended to introduce cooked pureed vegetables. Introduction of solid prior to 4 months of age is associated with increased weight gain and adiposity. Infants do not need juices. But if juice is given, it should be started only after 12 months of age. An infant should never be put to sleep with a bottle or a sippy cup filled with milk, formula, or juice because this can result in early childhood caries. ECC children with eczema may be at a high risk of developing peanut allergies. These infants should be introduced to peanut-containing products around 4 to 6 months of age and older to prevent peanut allergies in the future. Cow's milk is not recommended before 12 months of age. Honey risk of infant botulism should not be given before 1 year of age. Human milk contains little iron, so infants who are exclusively breastfed are at increased risk of iron deficiency after 4 months. Feeding and nutrition are crucial aspects of infant care, ensuring proper growth, development, and health. The nutritional needs of infants change rapidly during the first year of life, transitioning from exclusive milk feeding to the introduction of solid foods. Here's a detailed discussion on the topic, breastfeeding. For exclusive breastfeeding for the first 6 months, the American Academy of Pediatrics AAP and the World Health Organization recommended. The exclusive breastfeeding for the first 6 months breast milk provide ideal nutrition and has antibodies that help protect against many common childhood illnesses. Genesis breast milk is easily digestible and contains the perfect balance of nutrition. It's associated with reduced risk of asthma, obesity, type 1 diabetes, and sudden infant death syndrome (SIDS). Continuation with complementary foods after 6 months breastfeeding should continue alongside the introduction of solid food until at least 12 months of age and beyond, for as long as mutually desired by the mother and child. Formula feeding, an alternative or supplement when breastfeeding isn't possible or needs to be supplemented. Infant formula have healthy alternative formulas aimed to closely mimic breast milk and are designed to provide all the necessary nutrients. Types of formula. There are various types of formula available, including cow milk-based, soy-based, and hypoallergenic formula. Such different dietary needs and allergy introduction of solid food. Timing solid food should be introduced around 6 months of age. Infants show signs of readiness, such as being able to sit up with support and showing interest in the foods. First foods, single-grained cereals like iron-fortified rice cereal, pureed fruits, vegetables, and meat can be introduced one at a time to monitor for any allergy reactions. Texture and consistency. Start with similar single-ingredient purees before moving to the thicker texture and combinations of food as the infant grows and becomes more experienced with eating. Allergenic foods. Foods known to cause allergies like peanuts, eggs, and fish should also be introduced early and in small amounts, as current guidelines suggest this may reduce the risk of developing food allergies. Nutritional needs. Iron and zinc, particularly important around 6 months of age, especially for a breastfeed infant. Iron-fortified cereal or pureed meat can be good first food to meet these needs. The vitamin D. Breastfeed infants may require a vitamin D supplement, as breast milk might not provide enough formula fat. Infants usually get enough vitamin D from fortified formula. Feeding practice. Responsive feeding. Pay attention to the infant's hunger and fullness cues. Start with small amounts and increase gradually based on the child's appetite. Safety. Avoid choking hazards like whole grapes, nuts, and hard candy. Ensure the child is seated and supervised while eating. Avoiding salted foods, honey, and raw foods. Honey should be avoided until after the first year due to the risk of infant botulism. Similarly, raw or undercooked foods can pose a risk of infection. Hydration. Breast milk or formula is sufficient for the first 6 months. Infants typically don't need additional water. Small amounts of water can be introduced with solid food after 6 months. Feeding and nutrition in infancy lay the foundation for child's health, growth, and development. It's important for caregivers to be informed and responsive to evolving and nutritional needs of the infant, ensuring a balanced and safe introduction to a variety of foods after the exclusive milk feeding period. Always consult healthcare providers for personalized advice, especially for managing food allergies or special nutritional needs. Okay, so let's sum up what we have read. For week 3, feeding and nutritional of infant, discuss breastfeeding, the best way of feeding of the children born in time, perfectly satisfy children feeding needs, protect against the feeding allergy, fully aseptic, and improve child immunity. Beginning a few hours after delivery, feeding on demand, minimum 6 months. So no cow milk until 12 months to avoid iron deficiency, jaundice. It's recommended to breastfeed more Most mothers start breastfeeding around 18 months. Solid nutrition introduced after first to 6 months, mostly vegetables, fruit, ground food, boiled potatoes. Supplementation of iron preterm 1 month, 2 milligram per kilogram, term 4 months, 1 milligram per kilogram, formula in case of intolerable breastfeeding. Human milk feeding decreases the incidence and severity of diarrhea, respiratory illnesses, otitis media, bacteremia, bacterial meningitis, necrotizing enterocolitis. Okay, infants who are breastfeeding more have reduced risk of asthma, obesity, type 2 diabetes, ear respiratory infection, decreased risk of postpartum hemorrhage, more rapid recovery evolution, longer period of amenorrhea, decreased postpartum depression. Adequacy of milk intake can be assessed by voiding and stooling pattern of the infant. Total weight loss after birth should be not exceed 7%. Birth weight should be gained by 10 days. The mean feeding frequency during the early weeks postpartum is 8 to 12 times per day. Newborn period, feeding frequency during first 3 days of life breastfed infants is inversely related to the serum level of bilirubin. The use of water supplement, vitamin D supplementation, breast tenderness, engorgement, and cracked nipple are most common problem encountered by breastfeeding mothers, lactating women with breast fever, chill, malaise, vasculitis. Maternal infection with HIV is considered contraindicated. Mother has active tuberculosis, syphilis, varicella. Restarting breastfeeding may be considered after therapy is initiated. Breastfeeding, including pediatric galactosemia in infants with phenylketonuria, absolutely drugs are contraindicated. Approximately 6 months, complementary feeding of semi-pulp solid food is suggested. Introduction solid prior to 4 months of age associated with increased weight gain and adiposity. Okay, so infants do not need juices given it started only after 12 months of age. Infants should never put sleep with a bottle or sippy cup filled with milk, formula, or juice because they can eat. Result in early childhood caries. Eczema may be a high risk of developing peanut allergy. Cow's milk is not recommended before 12 months of age. Honey should not be given before 1 year of age. Human milk contains little iron, so infants who are exclusively breastfed are at increased risk of iron deficiency after 4 months. Breastfeeding, exclusively breastfeeding for the first 2 to 6 months. Benefits and continuation with complementary foods after 6 months. Alternative or supplement formula, infant formula, healthy alternatives, type of formula, cow milk-based soy based, and timing around 6 months of age, first food, single grain cereal, pureed fruits, vegetable texture and consistency, smooth allergenic foods, allergic peanut, eggs, fish, introduce early and small amounts as current guidelines suggests may reduce the risk of developing food allergies. Iron and zinc, vitamin D. Responsive feeding, pay attention, safety, honey and raw food, breast milk or formula is sufficient.